So I always try to encourage my trainees to trust the process, that the process itself is very healing. It's all built into the method.
Therapeutic methods like sociometrics and psychodrama can help people heal from addiction and trauma. Today, we speak with Meadows Senior Fellow Dr. Tian Dayton about why floor checks are a great psychoeducational exercise to teach group dynamics and interpersonal skills undermined by trauma. My name is Dominic Lawson. Let's go beyond theory.
Dr. Tian Dayton, thank you so much for coming back to Beyond Theory. It's a pleasure to have you again.
Pleasure to be here. Thank you for having me.
Absolutely. So we're here in Vegas for the Trauma and Addiction Conference. And before we get into that, I want to ask you about something because I think the first time I saw you in person was last year in Orlando. You gave a talk there. And like literally 45 minutes before your talk, you were swimming.
Oh,
right. You took a swim. I guess I was just curious, is that like something to like kind of just like get into the mode of speaking, or I'm curious about that process.
That's funny. It was so beautiful there. Mm-hmm. And there were so many lovely ways to take care of yourself and, very importantly, move your body. Everything I do brings the body in.
Okay.
You know, RTR sociometrics, relational trauma repair sociometrics, and psychodrama. Psychodrama is the first embodied method of therapy ever developed by a man called J.L. Moreno in turn of the century, Vienna. All other experiential embodied approaches come from that role-play method. So anything that comes from that line is being true to a very time-tested set of techniques and method. So it's all about if you involve your body, you know, Stephen Porges, involve your body. Bessel, van der Kolk, everybody's talking about how feeling is in the body. And that's how I take care of myself, by mind and body.
Absolutely.
And the pool made it easy.
Right, of course. And even in at that conference, I saw you go through some of those exercises with some of the attendees. Would you be willing to talk about that a little bit?
Sure, of course. I think you're referring to both psychodrama and relational trauma for sociometrics. Psychodrama is a role-playing method. The triadic system of J.L. Moreno is psychodrama, sociometry, and group psychotherapy. So Moreno is the creator of group psychotherapy. If you back that up, he started with psychodrama. This was in Freud's time in Vienna, when all of the therapy was happening one-to-one. So he originated letting people talk to each other face-to-face in a direct encounter in a group. Sociometry is the science of group dynamics. Sociometrics are the concrete way of exploring group dynamics. That's what you saw me do.
Okay.
I have personally invented something I call floor checks.
Right.
Because Moreno's sociometrics are wonderful but limited. Floor checks are something that you can use as your entire experiential programming if you want to. They are psychoeducational. They get people out of their chairs and connecting with each other, which is always an issue in therapy groups.
Right.
They get people tolerating feelings that they find intolerable, which is one of the purposes of therapy, translating those feelings into words and sharing them with another human being. And then, before they stop that process, listening to other people share their feelings without exploding or imploding. So this retrains the skills that trauma undermines, brings us out of isolation, teaches us how to feel difficult feelings, use our words to share them, to reflect on them, and listen as other people do the same. All of these are undermined by trauma. It also brings you out of frozenness because it's directive, but it's open-ended. That's what I like about floor checks. They're a very clear directed process, but within that, they're very open-ended. So you find people laughing, tearing up, patting each other on the back, and then moving. There's a beginning, middle, and an end to each question that's asked and answered. And it's all about choice. For example, rather than going around the room and saying, what are you feeling? 1, 2, 3, 4. I put feelings all over the floor. I call this the feeling floor check.
Okay.
And say, what feeling are you experiencing right now? Walk over, share a sentence about how you're experiencing it. Or what feeling do you sit on? What feeling do you not like to express? Walk over, choose it. So the choice is the client's. It's self-directed. That builds autonomy, it builds resilience, it builds ingenuity.
Does that self-directedness also allows for kind of like self-pacing as well, where you can kind of go at your own pace?
Exactly.
Okay.
If you don't want to share, you don't share.
Okay. All right.
You can participate, but not have to be on the spot. And the whole design of it is to not be on the spot, right? You're talking when you feel like it. When you're in psychodrama, we say, go with a warm-up. So I say, who's warmed up to say something? And if you don't feel warmed up to say something, you don't have to. But if you do, you have the floor.
Gotcha. And so that kind of brings us to a workshop here in Vegas. You want to share some of that a little bit?
Sure.
Yeah.
It was, we had a wonderful group. Very, something about Las Vegas. People come to, I don't know what it is. But the entire group was out of their chairs. I mean, very few people were on the edges yesterday. We started with sociometrics. We started with, we call it a spectrogram, a locogram, and the floor checks. Another floor check we did yesterday was an anger floor check. All the ways anger manifests. People think of anger maybe as 1 or 2 feelings. It's us. It can be depression, it can be stonewalling, it can be self-medicating. So what's your go-to form of dealing with your anger? People go to it. And then, so that again educates, you can do that with anxiety, depression, trauma symptoms, anything. That's how it becomes, floor checks are psychoeducational. Then we did a lot of psychodrama because we had a couple of 100 people or more coming in virtually. And they could track more easily the actual role plays. So I think what I might say about the psychodrama is that is the first embodied form of therapy. People are choosing someone to play either a part of themselves or a character from their lives. And in the act of choosing and concretizing that through an empty chair or a role player, you are naturally giving it some space from being kind of marooned inside of you, right?
Right.
So I always try to encourage my trainees to trust the process, that the process itself is very healing. It's all built into the method. You don't have to think of clever things. You don't have to being directive is not a great idea. Just be directive only when necessary. Otherwise, the stage belongs to the protagonist. In psychodrama, we follow the lead of the protagonist. The drama goes where they feel warmed up to go. And then we use the techniques, which are doubling. And that is actually standing up behind the chair and doubling for yourself.
Okay.
Or a role player speaking the inside life, what's not being said from here. It's quite helpful because we all kind of go around with a little, Jiminy Cricket voice in our heads. So that gives a way to concretize that. Again, without saying, can you tell me a little more about that? Or, you don't put people on the spot as much when you just say double for yourself. What's going on at a deeper level? And I can double, not me as the director, but I can invite group members. Does anyone feel warmed up to double for the protagonist? Or the protagonist in another role.
Right.
Role reversal is the core technique of psychodrama. That is psychodrama's gift to the world. It is important because When we say there's a trauma dynamic, right? We repeat through life those relational dynamics that were traumatizing to us. They don't only live inside of us in the form of one, they live as a dynamic. So when we say we have a dynamic with our mother or our father that is problematic, there's this going on in that dynamic, then when we recreate the dynamic, we recreate it with this going on in the dynamic. We need both sides of the dynamic. We need to explore both sides in order for the healing to be full, in order to understand both sides. I mean, role reversal has profound implications for, Moreno would say, healing all of mankind. If we can stand in the shoes of the other and feel as they feel momentarily, think as they think, or at least try to. That's the job of a role player or protagonist when you reverse roles. You physically change places, but you attempt to enter the psyche of that other person. When you do that, say if we go back to the mother, say in my case, daughter dynamic, you bring it out onto the stage. It's no longer swinging around your head, but somebody is embodying your mother, or you're using an empty chair. And then you're experiencing your own feelings and saying everything you want to say, but then you're reversing roles and experiencing hearing that come towards you. And then you try to enter, it would be the mother in that case, if I were reversing roles, and feel as she feels. And the curious thing about it, people worry they're going to lose a sense of self if they step out momentarily. They actually come back feeling more whole because they've understood sort of what has shaped them. And they also get a chance to detach a little bit because in, say, the mother role, they find out maybe this all wasn't so personal the way she treated me. She was who she was, and I happened to be there. So those kinds of awarenesses are the things we try to come by in therapy, but psychodrama makes them so easy. And then the client comes out feeling as if they did it themselves, in a sense, especially if the therapist has the wisdom to only have their presence felt when necessary. Otherwise, the client should feel it's really their stage.
How difficult is that to relay that to the therapist to do exactly what you just explained? Because I imagine, there's times where they're not trusting the process and they want to kind of speed it up a little bit. Kind of share that.
You're good at asking these questions. That is the core thing, right?
Right.
That's why I developed RTR sociometrics.
Right.
Because there are so many. And once I found out about psychodrama, I found out first as a client. I did a week's family treatment for being a child of an alcoholic. It was so freeing to do my own psychodrama that I just thought, I've got to do this forever. And I became a therapist, right? I mean, I was a therapist actually,
right,
but I became a psychodramatist. I was able to devote more than a decade in my life really to this. Not everybody is. And I tend to do programming for addiction treatment centers. So floor checks break psychodrama down so that you're doing a smaller role play. I found over the years that if I gave the staffs I worked with, and the Meadows, the Meadows grows and grows and grows. There's more and more staff all the time to train. They are doing such frontline work that if I give them certain techniques, they grab them right away because they're in the trenches with people. So that's an ideal fertile training ground. And it was also an ideal fertile ground for me to develop something new because I could practice it. I had my trainees to practice it initially. I had my smaller groups to practice it. And then I could give it to other people. And it just kept working and working and working. That's the magic of floor checks. They just work, and that's easy to train clinicians to do. It doesn't involve role play unless you learn how to add role play. The role play itself, to your very insightful question, I wake up in the morning thinking, how can I get this across? This morning I was sitting thinking, how How can I better get this across? And I've been training for 30 years. Some people want to rush it. I try to break it down. Don't push for a catharsis. Your work isn't to get a big catharsis of abreaction, of anger. We don't always have to hate the parents. All of the mistakes that happen with psychodrama. One of the big mistakes, as long as you're being honest, I'm being honest, is the gods are offended by hubris. And hubris is in every role. And if a therapist wants a result and wants to entertain a little bit and wants to feel good themselves, this is really our opportunity to serve the needs of somebody else. It's a being in the moment and being at service and not being in our own heads. That's the toughest thing, is if therapists get in their heads and they think, it would be good if I did this, it would be good if I did, then you're not with the protagonist. And you're not allowing what we call a psychodramatic trance state to engage. If I'm talking to an empty chair and that represents my mother, it's remarkable how much it starts to feel like that's who I'm talking to. But we have to trust people. We have to trust that within each of us those roles exist. Right. And that we have an urge to talk and to say what we couldn't say then. And it's not just to get angry. It's to say, I love you, and I loved you so much. And it hurt so much to watch you kill yourself with alcohol. This was yesterday. It's blocked anger, blocked hate, blocked love, interruptions in the attachment dynamic. It's like a drain that's clogged, Right. We just need to get what's clogging it out. And then trust that people have what Zirka Moreno, my trainer, always referred to as their own autonomous healing center. We want to get what's in the way out of the way so people can get in touch with their own autonomous healing center and reignite the faith they have in themselves.
Okay. I'm curious because you were talking about not being with the protagonist. When you see people, and you're doing that work and they have this epiphany, what does that mean personally for you? To see them, watch them go through that process?
Say that again. I ask it a different way so I understand exactly what you mean.
I guess what I'm saying is when you're doing the workshops and you're doing the activities, right? And you see a person go through that process and they start to have those epiphanies, like the work is starting to take hold. Mm-hmm. Like personally for you, what does that mean? Because I think this speaks to, being of service to somebody else. Yeah,
I think as you ask that question, I can feel it in my body, actually. It makes me happy. Nobody's ever asked me that question exactly that way. I think it's funny. My grandson has been taking drone pictures. He's 10 years old and he started a business of taking drone because he's so good at it. And he's making a website with his mother and he did the about himself. And he said, his name is Friso. Friso likes to take drone pictures to make people happy and to give them a new perspective on their beloved places. It was so sweet, but I think it's the same exact feeling. It makes me happy to see people. There's something about watching that process that is life-giving. It's if you watch, when I was little, I had a kitty. My kitty had kitties, and when I was older, my dog had puppies. It's a birth of sorts because people are giving a birth to a part of themselves that they didn't have a connection with. They're awakening, and to be a part of that awakening, it just keeps going for me. I probably haven't retired yet. I mean, it's too beautiful.
I hear that. What's next for you, Dr. Dayton? I know you talked about you doing some training with the Meadows. What's next for you in the coming months?
Well, I'm talking to Pesci about this model of relational trauma repair sociometrics. Right. We've created a certificate with NADAC, National Association for Drug and Alcohol Counselors. And Pesci and I are talking about what to do with that. I would say, and I've got a team of therapists who I've trained for some 30 years, some 20, nobody under 10. They're great trainers. They're already, we had a training in Alaska, we're having in California right now, Nashville. We're going to have one in Albany soon. We have trainings all over the place where I send people. I think that's next. I need to turn it over. And I need to take joy in turning it over and see it, have joy in connecting people with people and watching this expand. Because honestly, this RTR sociometrics is just much more practical to train people today. My son is a therapist, and I'm in touch with his age group, right? And how they operate. And over the last 15 years or so, I have observed that rather than get PhDs the way my generation did, we sort of specialized in a track. They're getting masters, and then they're training in DBT, in family systems, in EMDR, in IFS, or they're choosing a couple of things that it's different. And I understand that for this generation, it makes a lot of sense. So I think RTR sociometrics will be the experiential version of that, the embodied version of that. It's suitable for groups, suitable for one-to-one, suitable even online in embodied forms. That's what's next, now that you ask, okay. I think.
All right. Dr. Dayton, it's been a pleasure to have you again on Beyond Theory. And my last question, any lasting thoughts that you want to put a bow on this conversation?
Well, you're really asking good questions.
I try.
Yeah.
I try.
Do your homework, obviously. A lasting thought. My stepfather used to say, hang in there. I think that's a lasting thought. Have faith.
Okay.
Have faith. Hang in there. Love who you love. Don't give up on yourself. Don't give up on life. There's a very beautiful reading called We Are the Ones We've Been Waiting For. Let go of the shore. Things are moving fast these days. It's a challenging world, but, like in Desiderata, it's still a beautiful world.
100%.
And we need to have faith in our world and do what we can. Not to think that what you do is too small, just to do what you can.
Beyond Theory, powered by Meadows Behavioral Healthcare, is produced and hosted by me, Dominic Lawson. The film recording of this episode was created by our videographers, Haley Storer and Jesse Adelman. You can watch it at beyondtheorypodcast.com. Special thanks to Dr. Tian Dayton, Senior Fellow here at MBH. Find out more about her work and our other Senior Fellows at meadowsbh.com/Senior Fellows. Be sure to like, review, and subscribe to the Beyond Theory podcast on Apple Podcasts, Spotify, or wherever you listen to podcasts. And if you think someone could benefit from these stories, please share it with a friend, neighbor, or loved one. Finally, thank you for watching, and I hope you join us next time for another episode of Beyond Theory.